Okay, good evening, ladies and gentlemen. Welcome back to QIU's World Pharmacies Day webinar. I'm Natalie, and I'm here with my partner, Ms. Darshini, and will be the MC for today's webinar. So this is the last session for our 2 days webinar, and we hope you've had a great time with us so far. So just a quick reminder before we get started, kindly ensure that your mic is muted throughout the whole session. And our attendance form will be shared towards the end of our webinar, so kindly fill it in before you leave to obtain your CPD point or your CCA hour. So without further delay, let's get started with tonight's agenda. So today, we're delighted to have QIU's Dean of Faculty of Pharmacy, Professor Datuk Dr. Ellen Mathews, to share his thoughts on the revolution of pharmacy profession. Professor Datuk Dr. Ellen Mathews holds a Master's in Clinical Pharmacy, Doctor of Philosophy in Clinical Pharmacy and Operations Management, a Graduate Certificate in Sales Management, and a Graduate Diploma in Marketing. His work experience includes 14 years in government hospital, 22 years in the pharmaceutical industry, and 13 years in academia, 6 of which as the Dean of Faculty of Pharmacy in QIU. His extensive experience has made him the perfect speaker for this topic. So without much ado, let us welcome Professor Datuk Dr. Ellen Mathews to give his talk. Datuk, you may begin whenever you're ready.
Yeah, thank you, Ms. Natalie. And I'm glad to see you as one of our pharmacy graduates here. And good evening to everyone. And this topic, we are looking into the revolution of pharmacy profession. And the word revolution sometimes can bring in different type of connotation, yeah. But a revolution have taken place in the pharmacy profession. And I'll try to take you through this topic. Of course, it's very relevant regarding the World Pharmacists Day theme, always trusted for your health. The pharmacist is always trusted for your health. So before I go into that particular chemical molecule, you can see there, chemical structure and molecule, paleopharmacological studies, these archaeological studies have attested to the use of medicinal plants from prehistoric times. So it is that. What is unique is even until today, we have got medicines being produced from nature. And the one you see is actually cyclosporin, an immunosuppressive drug that we use in transplantation and so forth, came actually from a fungus. So if you let our minds a bit further wandering, you'll know that God have actually prepared medicines in nature for mankind. Until today, we have got this coming from nature. So, in the very beginning, there were pharmaceutical texts already written on clay tablets by Mesopotamians. There were already clay tablets, and in these clay tablets, they had formulas, they had instructions how to make the medication, either by infusion, boiling, filtering, or spreading. These are all mentioned in the ancient texts on clay tablets. And even today, we are talking about infusion, boiling, filtering, and spreading, and so forth. Yeah. So it goes a long way back. And Babylon, in the same area there of Mesopotamia, they provided the earliest record of the practice of apothecary or pharmacy. Interestingly, Indonesia uses a lot of the word apothecary. And the town Tawau, some of you may know in Sabah, Tawau, which borders the Malaysian town of Tawau, which borders the Indonesian Borneo, they also use the word apothecary in Tawau. Okay, so, and at that time, this is recorded alongside the ill person included a priest a physician, and an apothecary or a pharmacist to attend to their needs. Interesting, huh? This is way back in history, where in the patient side, they had a physician and a pharmacist, at that time also a priest. And this particular picture, which I'm going to share you now, this picture here, I've taken it from the Washington State University College of Pharmacy. You see, there are two brothers actually, there are two brothers, two Arabian Christian brothers. One is the pharmacist on your left-hand side, and the other one is the physician. And this is in AD 300. You're talking about 1,700 years ago. And the physician brother, Cosmas, he's explaining the condition that the patient is suffering. At the same time, the pharmacist, who is well versed in also in disease condition, listening and preparing a medication for that particular condition. And we are talking about 1,700 years ago. So, and even at that time, they already had collaborative practice. Okay, let's see what happened after that. Then came the separation of pharmacy and medicine. The picture you see there is actually a pharmacy which has been in existence, I think, for more than 1,000 years, and is still operating in Europe. Yeah. So, what brought about this separation of pharmacy and medicine? From the picture I showed you before, whereby you have the pharmacist and the doctor attending to a patient. In ancient Greece, they've already separated the functions. In Ephesus, Turkey, and I was very fortunate to visit Ephesus, Turkey, and I saw this, there was a stone sign of a pestle and mortar opposite the doctor's clinic. So already the separation, and this we are talking about 2,000 years ago. In India and China, the separation already in the 1st century AD. In Japan, in the 6th to 7th century, pharmacists were very highly respected, and it is recorded that their status was even more superior than the physicians. Probably because the medicine comes from the pharmacist, and the medicine is the one which is going to heal the patient. So they were given a higher status. This is recorded in history, higher, superior status than the physician. In Baghdad, the first pharmacist was in 754 AD. And by the 9th century, it was already regulated by law. And in the 10th century, the role of the pharmacy and the pharmacist was also stated. Sorry, I'm not sure why it's not moving here. Oh, yeah. But in Europe, in the 12th century, pharmacies were already established. And in 1240, Emperor Frederick II, he sent out a decree, stating the separation of the functions of the pharmacist and the doctor. So this is in 1240. So what happened after that? So when the separation came, slowly the pharmacist retreated to the pharmacy and waited for prescription to come. And the prescription gave all the details of the ingredients, how it should be mixed and so on. So the pharmacist just carried out and retreated away from the patient itself and was in the pharmacy waiting for prescription. So they basically did compounding. Of course, in due time, in the mid-50s, you have the mass scale production. And pharmacists still remain in the pharmacy, and the role was a lot to do with making sure the prescription is okay. Everything is fine with the prescription before dispensing it, or prescription screening, as we call it. So what necessitated the move to be near back to the patient? Yeah, of course, industrial pharmacy is crucial. The compounding, the production, even from ancient time until now, is critical. Industrial pharmacy is critical because without industrial pharmacy, there would not be any medicines. So the mass production of medicine in the part of the 1900s towards the mid-1950s and so on, where more and more industrialization came about, although in Malaysia, it was only later part of the 1980s and 1990s, you have mass-scale industries coming out. So this is the driving force which made the profession, especially the drive came from the USA, that they need to look further into the role of the pharmacist and the move towards patient care and clinical pharmacy. Really, the move actually started from the USA. But we talk about 1950s, we already had our Poison Act Malaysia, 1950. And inside there is actually prescribing rights empowerment. I'll talk about this a bit later. So industrialization, where all the pharmaceutical dosage form was mass produced, brought out the situation for the profession to really rethink its role and purpose. And with it, of course, the curriculum also changed dramatically. So the move back to be near the patient and the practitioner, both, yeah? And really in around 1970s, where you have ward rounds and clinical pharmacy, and courses in clinical pharmacy was introduced into the pharmacy curriculum. I still remember the medical specialists giving us lectures on the medical condition and so forth, because there were not many clinical pharmacists to teach clinical pharmacy at that time. So 1970s was the start of ward rounds and clinical pharmacy, the concept and so on, even though the philosophy of practice of pharmaceutical care did not come. It came much later, which I talk a bit later. So more and more, if you look at my picture on the right-hand side, more and more the collaborative practice, which happened thousands of years ago, is coming more and more into reality now. You see the physician-pharmacist collaboration type of a practice. And in the 1980s, the evolvement of specialized services came about. And I was one of the fortunate ones to be sent to UK to study clinical pharmacy. And so when I returned, I implemented TPN, or Total Parenteral Nutrition, therapeutic drug monitoring, and cytotoxic drug reconstitution. And in 1990 was the breakthrough, I would say a revolutionary breakthrough in pharmacy practice. And that is the concept of pharmaceutical care, and which provided the philosophy of practice for pharmacists. Pharmaceutical care by Hepler and Tran, where they stated that the pharmacist's responsibility role is ensuring pharmacotherapeutic outcome are achieved and the quality of life of the patient is also ensured. So because medicine got side effects and so on, and will affect the quality of life of patients. So these are two main pillars of pharmaceutical care. It came out in 1990. So we have actually about 30 odd years. So from thousands of years until into 1990. So 1990 to now, we are talking about 30 years. A big revolution actually have taken place in terms of pharmacy practice. You see the picture on my slide here about injections being carried out by pharmacies. So all the while, remember, if I take you back again, initially the pharmacies were compounding medicine for the patient. At that time, of course, 1,000 years ago, they didn't have injections and so on. And then slowly the pharmacies retreated to the pharmacy and waited for prescription, and they only become an advisor, okay, a drug information service, advisor, recommending, making sure the prescription is okay, but administration of drugs was not there at all. Administration of drugs, especially injections and so on. And so there was not within the purview of the pharmacists. But why not? We study everything about the medicine, about the product. We give lectures to nurses and even medical students and so on medicine and injections and so on, yet we don't do it, yeah? But that is all changing. A revolutionary change in practice is coming through, that now pharmacists are allowed to administer injections. Malaysia, not yet, but I'm sure it will come in time. And by the year 2000, another major breakthrough came, whereby the setting up of medication, it's not medical, yeah, medication, therapy, adherence or management clinics. In Malaysia, we are at the adherence, ensuring adherence to prescribed medicine. But in other countries, they already moved into management. So the pharmacy is further empowered to manage the patient fully. Even in the UK now, with the National Health Scheme, when you go into the center, there will be a pharmacist and a doctor there. And there will be someone to tell you, oh, yours is a medication-related issue, please see the pharmacist. If it's a disease-related issue, see the doctor. So this is already coming. And basically, we in Malaysia may need to give to the next step now, medication therapy management clinics, where the pharmacists are empowered to manage the patient who are already on medication. The other major revolutionary change which has taken place is the word prescribing is linked to pharmacists. This is a revolutionary type of a concept, pharmacist prescribers. Because all the while we have been taught, even my time, doctors prescribe, pharmacists dispense. But this revolutionary change has taken place where there are now pharmacist prescribers. That means pharmacists can prescribe medicine. I'll touch on it a bit more later on, talking about these pharmacist prescribers. Another revolutionary change in practice. And more pharmacists as administrators of medicine. Last time, doctors administer medicine, nurses administer medicine. Pharmacists are not in the realm of administering medicine, but that is very odd because we are the only professional which we learn every aspect of medicine. From formulation, production, we know exactly what's in the medicine, and we also teach about administering medicines. So more and more, another revolutionary change is taking place is pharmacists as administrators of medicine. Next important step would be establishment of pharmacy specialists. Also already happened, a revolutionary change has happened. You heard of dental specialists, you heard of medical specialists, but not so much of pharmacy specialists. But this has already been established in Western country, developed world, including Singapore, where they have got clinical pharmacy specialists and they have a register of specialists and so forth. So that's another important dramatic step which has taken place. Now, just to tell you that our role as dispensers of medicine may be threatened now. because of technology. And there's a study which confirms that routine jobs, they may be at risk. So can you think about medicines? A patient already been diagnosed, put on a range of medicines, and he goes to a till, which is already happening nowadays. He enters his data, the list of medicine comes out, he confirms that. With the confirmation, robots go and pick up the medicines from the warehouse. I think yesterday we heard about from Prof. Yuan Kahe, everything in the warehouse is automated. Robots can go and pick and store and take the medicines. Then it'll be dispensed to something like ATM machine to the patient with all the cautionary labels and so on. Okay, so these are the things happening now. There's another revolutionary change. Many a time we are concerned about the medical profession. What the medical profession will not like this, they will not be happy. I'm really not in the line of thinking, because I have worked with the medical specialists when I set up all these specialized services. They are not the problem. I think the problem is how we as pharmacists look upon it. As long as we can bring patient care, the common ground of patient care, the medical doctors are never the threat. So in 2013, the British Medical Association came up with this statement that in recent years, community pharmacy must transition from a business model relying on dispensing how many scripts we dispense to one which is more heavily reliant on clinical services. And as I mentioned just now, in the UK, they've already implemented this. A health center will have both pharmacists and a doctor there. Yeah. And there are 15 areas of management that you need to do. So in the developed world, how did the developed world become so involving the pharmacies? I spoke to some people even in Australia. They say it's all because of research. The research showed that when you involve the pharmacists, the mortality rate comes down, hospitalization comes down, and so on. And there's better outcome. And the other important thing is they realize that you can save the government money. So anything you can save the government money, they will be happy, yes? So that's why more and more pharmacists are involved there. So the prescribing rights in the UK, Australia, New Zealand, all have been by law. And administration of medicine, including vaccination, COVID-19 vaccinations, are carried out by pharmacists, including the one in the Philippines. In Southeast Asia, Philippine pharmacists are empowered. So prescribing, yeah, and there is a law in UK now whereby the law says pharmacists, independent prescribers can prescribe any medicine for any medical condition. Same level as the medical practitioner. Okay, so this is another major revolutionary effect. In terms of community pharmacy, let's see what the world, the International Pharmacy Federation says. Very fully, that we must maximize the potential of the pharmacists. In what areas? The core competency, which is stated, is prescribe, dispense, administer, and review. Okay, so these are the revolutionary changes which has taken place. In Malaysia, we do have a law which permits community pharmacists to prescribe group C poisons for treatment. It's properly covered. And what do they do? What do they prescribe? In what conditions? By responding to symptoms. You have a cough and cold leading a group C poison, pharmacists can respond to symptoms. They're not diagnosing, they're responding to symptoms. And they know if they need to be referred. If they know something is serious, they can refer. Medicine management, for example, a patient or a diabetic patient already on metformin, which is a group C poison, pharmacists can continue treating that patient. Oral contraception is another area pharmacists can prescribe. In the hospital, I mentioned the 3 clinical specialized services are already there. TPN, TDM, oncology, clinical pharmacy, all of this, there are 2 components here. One is the product compounding, which is not clinical, and patient side management, that is clinical. So if you only have producing the bags for the TPN, you are not actually carrying out clinical pharmacy services. Now we have the medication therapy management clinics. I understand there were 14 clinics in the hospitals where pharmacists run the clinics. Patients are referred to the pharmacists. But at the moment, they call it adherence. We must move to the management. Although I understand the anticoagulant clinic, the clinical pharmacists actually can change doses and so on. I mentioned about clinical pharmacy specialists already just now. Our next step forward in our revolutionary change would be creation of clinical pharmacy specialists. Right, I'm only going to highlight my last slide here. I'm only going to highlight two things. This is the WHO slide for pharmacists. I'm only going to highlight caregiver. Remember, pharmaceutical care. So we become a caregiver. And caregiver, pharmaceutical care covers both outcome management as well as quality of life. And the other key thing I want to emphasize is the revolutionary changes in you're a decision maker. So the pharmacists have become decision makers, not just carrying out decisions already done by another professional. So you can decide in terms of when you prescribe, when you medicine manage a patient, and so forth. You make decision makers. Okay, I think with that, I've come to the last slide, I think. Yeah, I have 25 minutes here, and thank you very much. And I'm willing to take any questions and try to answer them.
Thank you very much, Dr. Ellen Mathews, for the insightful presentation. We will now open the floor for questions. So if you have any questions for our speaker, feel free to drop them in the chat box or in the comment section if you are streaming from our Facebook or YouTube. Okay, if there are no questions, then we will proceed to our next agenda. Thank you once again, Dr. Ellen, for the wonderful talk. Next up, we would like to introduce our next speaker, Professor Dr. Syed Atif Abbas. Professor Dr. Syed Atif Abbas is currently the Deputy Dean of Faculty of Pharmacy at Quest International University. Professor Syed Atif Abbas holds a master's and PhD in pharmacology, and he is also a community pharmacist at Quest Pharmacy. Besides, Dr. Atif has 19 years of experience in academia, which makes him the perfect speaker to share his thoughts and experience on the uniqueness of QIU pharmacy program. Without further ado, let us welcome the next speaker, Professor Dr. Syed Atif Abbas, to give his talk.
Thank you very much, Ms. Darshini. I hope you can hear me clearly. Can you hear me?
Yes.
Okay.
Yes, sir.
Okay. Once again, thank you very much, MC. And Assalamu alaikum and a very good evening to everybody. I know it's already 8:30. I'm not sure that you all have taken your dinner or not. So please bear with me. You can always ask questions. If you have any question in between, you can just write in the chat box and then you can ask the question. The topic which I'm going to share with you today is the uniqueness of QIU pharmacy program, or why you choose a pharmacy program at Quest International University, Faculty of Pharmacy. Dr. Ellen already has mentioned about the detailed timeline about the pharmacy profession. Years back, I think since the mankind, this profession as old as the mankind. So we are celebrating today the World Pharmacist Day. So in conjunction with that, we must understand and we must tell the other public that what are the roles of the pharmacy profession. And I won't repeat the things which Dato already mentioned, but I will take the thing that three major areas as Dato has mentioned. And you can see that if you can just remember the picture Dato mentioned, the old Arabian guys and the pharmacists of today. So you can see that the pharmacists of today, you can see us pharmacists in the community pharmacy. You can see us in research, R&D. You can see us bedside teaching and learning. And you can see us in the industry. So we all are proud to be a pharmacist. And also, of course, like me and Dr. Ellen, in the academics. We have different practices, but we all are pharmacists. And also, just to let you know a brief about the life cycle of medicine. We all know the life cycle of the medicine. It starts with a small molecule, and then we find the lead molecule, then we research on that lead molecule. After that, we do the research on that molecule, and then eventually that molecule comes, we call it a medicine. And that medicine, it goes into the community pharmacy or in the hospital and clinical setting, and it's at the consumer and the patient uses that medication. And then eventually, of course, expired medications, they can be destroyed. So that's a life cycle of the medicine. And in the whole cycle, the person, the key role person is the pharmacist. Right from the beginning, right from the manufacturing, or before manufacturing, the identification of the active or the lead compound until it goes into the consumer's hand. The pharmacists are the main key players. So what are the main areas of pharmacy practice? Even if we talk about the Malaysian context, in the Malaysian context also, the graduates, they normally most of the graduates, they go into hospital and clinical pharmacy. They go into community pharmacy. They go into industrial pharmacy or in the academia. This is a general trend where the pharmacy graduates, they end up. Of course, in Malaysia, we have the other fields in pharmacy, like you can go into the regulatory affairs, you can go into the military, but these are the main areas which you can see in my slide. So again, I won't repeat very extensively. Dr. Ellen has already explained that what the pharmacists, they do in the hospital or clinical setup. This one already established the roles of the pharmacist. Now, and also what the pharmacists, they do in the industry, manufacturing, community. This all has been discussed just now in the academia. Now, keep in your mind, the graduates, they choose either clinical or hospital, community, or industry. Now, why to choose the pharmacy program at the Faculty of Pharmacy. Now, at this moment, I would like to, those who do not know this thing, I would like to proudly like to tell you that our pharmacy program got the full accreditation at the excellent status. And this excellent status is not just I'm telling or anybody else from the QIU is saying. This excellent status is given to us by Malaysian Qualification Agency and also Malaysian Pharmacy Board, who's looking at all the pharmacy programs in Malaysia, in all the 21 universities who are producing these pharmacy graduates. So they come and they evaluate us and they give us the excellent status. What they evaluate? They evaluate our curriculum. They evaluated our students. They evaluated our staff. They evaluated our facilities. More than 165 different areas were evaluated. We were evaluated. And in order to get the excellent status, we must have to have 90 and 95% and above. And that's why I use the word, I use the statement that I'm very proud to say this thing. I'm proud on my students, I'm proud on our staff, I'm proud on my facilities. Only because of these things, we got the excellent status and not any other, not all the universities. I'm not saying that we are the only one, but not all the universities, they can get the excellent status. So that's the main thing. Now, I will talk about from the perspective of the curriculum. Just now, I told you that what are the main areas where the students, the graduates, they end up. For example, they want to choose the clinical and hospital. They can choose community. They can choose industry. Now, our curriculum is tailored in such a way that it is not inclined towards only one side of the profession. Many universities, their curriculum is mostly universities, their curriculum is inclined towards clinical and hospital. So what about the graduates who intend to work or who intend to go into the community pharmacy or industrial pharmacy? They struggle. When they go into the real world, they struggle because they don't have that much exposure of these two fields or in any other field. So our graduates, what we do, we prepare our students based on all these actually four major areas. Even we prepare them to be very good in research, and they can end up to be a good lecturers. So now the question is how we train our students in order so that when they go into the real world, they fit into this real world. Now, I just go back to another thing which is very important, our logo and also our tagline. Our tagline is real world holistic pharmacy education. And that tagline is not just for the sake of tagline. We really stick to this and we seriously implement, and we are seriously implementing it, this real world holistic pharmacy education. Now, if somebody wants to work in the hospital and clinical, our curriculum is in such a way that we prepare them to go into that field. And how we prepare them? We are one of the very few universities which take the students from year one to the hospital. Of course, in year one, we take them to the hospital and just to show them the field. What is the role of the pharmacist? So they must understand what the pharmacist does in the hospital and clinical setup. And also, we have a very strong relationship with Ipoh General Hospital. And we have the adjunct lecturers from the Ipoh General Hospital who come and teach our students with the real world cases. These are the real cases which they discuss with our students. In this way, we prepare them. So once they are in the real world, they're not just studying the cases from an American book or from a book from a UK, but the cases which we discuss with them, either it is in the clinical pharmacy or in the pharmacology, these cases are real from the Ipoh General Hospital. That's one way. Another thing is, from the year one, we prepare our students how to communicate. That's very important. The communication skills are very important, whether they are working in any field. And of course, the communication with the patient is the key point. It's very important. The graduates must be very good in communication. So in order to do that thing, we take our students to, you can see this one. We have a very strong relation, and also we have MOU with one of the senior citizens' home in Ipoh, and we allocate each and every student a patient, and they go to this senior citizen home. Of course, not in this pandemic, but before that, and of course, once this will be over, we will start again taking our students there. So the students, they go there. You can see that our student is sitting with the patient, obviously under the supervision of the lecturer. But in this way, and this thing is assessed. We have 3 sessions for one patient. The 2 sessions is the teaching and learning, and the 3rd session, the lecturer observes them and give them the marks, because it's not just look-see thing. We take it very serious. We have a proper rubrics to mark them. In this way, they learn how to, the first thing, of course, in the year 1, we emphasize on the communication skills. Then, obviously, by the time they go into year 4, they are well versed with the medicine management. That is the integral part when they work in the clinical pharmacy. So in this way, we prepare them. Once they are in the clinical setup, they are quite well versed by taking how to take the patient history, how to talk to the patient. And of course, you all know that communication is not only talking. Communication is also listening. We teach them how to listen to the patient. That is also, that's how we are preparing our students to this part of the profession if they want to go to the hospital and clinical profession. Now, I go to the next one. The next one was maybe the students, maybe the graduates, they want to work in the community pharmacy. So community pharmacy, again, I'm again repeating this word, that I'm proud to say that we are one of the very few universities and only university which has a real pharmacy under the faculty. Under the faculty, we are the only one, the real community pharmacy we have. We have a real community pharmacy where the students, again, start from the year 1. We have a proper schedule for them. And the students, they come and they learn in this community pharmacy. Because it's a real community pharmacy, we have the real cases, the real patient, and also we have the real software which normally the community pharmacists, they use. So in this way, and also we all know that this community pharmacy, beside the science, is a business. So we teach our students the entrepreneurship, how to do the stock checking, how to manage a pharmacy. Because at the end of the day, if they are going to become a pharmacy manager, they must know how to manage a pharmacy. So this is again, in line with our tagline, real world, holistic pharmacy education. We are giving them the real world. We have changed this taboo that, oh, university life is different from the real life. We have really, and we are very successful in this, because we have received the feedback from our graduates, and when we get this feedback, I think more than anybody, we as a lecturer are so happy that when their employers, they say that, oh, your graduates are different, they shine differently. Because of course, you see, the employers, they don't have time to teach. What happens is the other graduates, when they go there, they spend a lot of time in learning the real world, because they have come up only, they studied only from the PowerPoint slides. We are using PowerPoint slides, but at the same time, we 100% believe that unless until the students will not see and do with their own hands, they will not be expert. Or at least they must be exposed to that real world. So in this way, you can see they are quite familiar. Even we teach them what are the ways how to open a community pharmacy. Because at the end of the day, once they are registered, if they want to open their own community pharmacy, they must know what is the process, what is the rules and regulations. So this is another way we teach our students if they want to go into the community pharmacy. Now, the next one, which is also one of the, again, I would like to say that no other private university, they have this pharmaceutical production pilot plant like we have. Maybe they can, the other universities, maybe they can have in the bits and pieces, the machines. But we have the pharmaceutical production pilot plant, exactly the line which is similar to an industry. And the students, they learn with their own hands. So you can see in this slide that all these machines, they are industrial scale machines, and they are not just for the purpose of accreditation. The students, they use, and I would like to mention here that during this pandemic, you see that most of the pharmacy faculties and the schools, they did not send their students for the attachment to the industry, because the industries, they were not receiving any students. But because we had our own pharmaceutical production pilot plant, and we gave our dedicated lecturers, they gave the training at this pharmaceutical production pilot plant. So that's how it is, how we are exposing our students to the real world. Again, we are not teaching the tableting machine only on the PowerPoint. When the graduates, they go into the industry, they are looking where is the button to on. They don't know, because they have not seen the machines in real. But what we are doing differently from the other universities, that we give the students the real world experience. That's how we are different from the other universities. So again, in line with our tagline, real world, holistic pharmacy education. So you can see that this all these pharmaceutical production pilot plant machines, the students, they are using with their own hands. So you see that I have covered these three main areas. Another thing which is very important, and I think yesterday also, of course, we have Ms. Lian in his talk, he already touched on that one. If we don't have a good and dedicated staff, the building and the facilities can't do anything without the qualified personals. So we have the experienced academic staff. Just now you have seen the Ms. Natalie has mentioned about the CV of Dr. Ellen, more than 40 years of experience in the industry, and then they brought his experience from the real world. And of course, we in community pharmacy we have Mr. Khairul Anwar, who is a community pharmacist for more than 20 years. So he brought his real world community pharmacy experience. So that's how we are giving this real world experience to our students. It's not only the lecture notes. No, the real world experience. So that is, of course, is because of the experienced academic staff. We have the experienced academic staff who are giving their knowledge to the student, and their knowledge is the real world knowledge. And also, just now I mentioned that beside the academic staff, we have the adjunct lectures. Adjunct lectures means that they are only with us, with the Quest International University. So they are dedicated with us. We have adjunct lectures in the clinical pharmacy, and these lectures, they come and they teach our students the real world, the real cases in the tutorials. And these all things, they are assessed. And of course, another thing which is that our all staff are registered pharmacists. So that's our uniqueness and strength of our faculty. Now, curriculum. One of the major thing which the auditors, they look into this is what we teach our students. So we have a very well balanced curriculum. As I mentioned just now, ensuring that once these graduates, they are out, they can go into any area of practice. And what are the main areas? Just now, as I mentioned, they can go into the hospital and clinical, they can go into industry, they can go into community, or they can go into research. Because in our curriculum, which is again unique from the most of the other university curriculum, we're teaching the pharmacy course, is the research component. Research component, many universities, they think is elective. It's not important. Elective means that if you want, you take it. If you don't want, you don't take it. But we seriously think that no, research must be a compulsory part at the undergraduate level. Because in any field, if you go, you must, even if you are going into clinical or hospitals, you are going into industry, you're going into community, you must, because in research, you're only not doing the research. In research, you learn the ethics. In research, you know how to deal with the certain situations that research teaches you. So if the research is elective, sometimes in the certain situations, you're not prepared. So it means that if you haven't taken the research, you're not ready for the real world. And this is what our curriculum is, again, different from the other universities. This is one example. Another our strength, our all basic medical science components are taught by the Faculty of Medicine, who are expert in their own field. For example, anatomy is taught by a medical doctor, physiology, biochemistry, pathology, all these basic medical science courses, immunology, microbiology, they are all taught by the experts from the Faculty of Medicine. Then we have a very strong pharmaceutical chemistry component. We have a major thing in our curriculum is the pharmaceutics and pharmaceutical technology. And also we have a dosage design, a dosage form library. This is again one of the things which is not in any other university in Malaysia. We have a library on the different dosage forms where the students, they can learn that what are the different types of dosage forms. The creams exist, the capsules, the tablets. The tablets have also different types of tablets, coated tablets, enteric coated tablets. All different types of this dosage forms are available in our dosage form library, and is for the students, where the students, they can go and they can search. The students should go anyway. And also we try that maximize usage of that library. Then we have in our course another thing, which is the teaching and learning is also different. Our teaching and learning is different from the others. For example, I will just give you one example, is the process-driven PBL, which I think Dr. Mahbub this afternoon, he had a very good deliberated on our process-driven PBL, which is again a uniqueness in our program. No other university is doing the process-driven PBL in this way. You can imagine that in this PBL, the students, they are exposed the 4 years, 27 different problem-based learning triggers, meaning to say they have undergone 27 presentations, 27 times. I can see Miss Natalie is smiling because she has just recently undergone this thing from this 27 times. So how they are grilled 27 times, different. So that gives them the real world experience, and they're ready. They're ready to work. They're ready to be in the real world. Also, we have the OSPI in almost every subject. We have the OSPI, which again is the real world thing. So I'll just very quickly go through on the added advantages that just I mentioned, that we have the formal linkages with the Ipoh General Hospital, and also with the pharmaceutical industry. With the big giants, we have the MOUs, not the just these industries, these kacang industries. We have MOUs with the big players in the pharmaceutical industry, not the kacang putih one. We have the MOUs with like Deep Brown, we have the MOUs with the Idaman Pharma, all these Hovitz, all these big pharmaceutical manufacturing companies. And also we have the Real Community Pharmacy, as I mentioned just now. Also we have the Consultative Council for Pharmacy Practitioners in all areas who give their input in the curriculum every year. Every year they come, they see our exam questions, they see our teaching and learning, they meet with our students, and then they give the report, and then we act on that report. Because we always think that this is a dynamic process. It's not a static process. It's a dynamic process, and we always, even in our now curriculum development committee, we have a permanent member from one of our alumni, because we strongly believe that the students who have graduated, they can give us a very good feedback, and we always believe in the feedback. So, and even our last meeting, he gave us a very good input because he just graduated, so they know that what things we further improve in our curriculum. So these are the things which we are doing continuously to improve our curriculum. So in the end, I would like to end my talk that if you think pharmacy, think QIU, Faculty of Pharmacy. That will make you one of the best pharmacists, not nationally, but I'm not scared to say internationally also. Thank you very much, and the floor is open for the questions. Thank you very much.
All right, thank you, Professor Atif, for the wonderful presentation. So we'll now open the floor for questions. If you have any question for our speaker, feel free to type them in the chat box or in the comment section if you are streaming from our Facebook or YouTube. Okay, if there is no question on the floor, then we will close this session now. Once again, thank you so much, Professor Atif, for your wonderful presentation. So I will pass the floor back to you, Darshini.
Yeah, Thank you, Natalie. Well, this marks the end of our session for the QRU World Pharmacies Day webinar. Thank you all for spending your valuable time with us, and we hope the information shared by our speakers today would be helpful in deciding your career path. The attendance link has been shared with you in the chat box. Please fill in to obtain the CPD points as well as CCA points for QRU students. Stay tuned for an exciting announcement on the World Pharmacies Day slogan creation contest. The results will be announced on QRU Farm Facebook page tomorrow at 11:30 a.m. and the winners will be contacted. We hope you have had a great time with us. Once again, thank you all. Good night and stay safe.